I think part of it is that science has become very complex, and we cannot be experts in everything.
Welcome to Collaborative Endeavors, a podcast about how scientists from different areas of research come together to tackle big health challenges, leading to better therapies and healthier communities. In this episode, we meet Dr. Olu Ajilore, an associate professor in the Department of Psychiatry at the University of Illinois Chicago College of Medicine. Dr. Ajilore applies his clinical expertise in the area of mental health, specifically depression and its medical comorbidities, as well as geriatric psychiatry. His research looks at how techniques like neuroimaging can teach us more about major depression and anxiety, and how these discoveries can be applied to new forms of therapy. Today, Dr. Ajilore shares the story of how he got started in translational research and why he believes working in multidisciplinary teams is the best way to stay on top of emerging science. He offers suggestions on how to bring together a strong team that can ensure these discoveries successfully make it out of the research setting and into everyday healthcare.
I actually started off doing a medical scientist training program in medical school, which combines medical school and graduate school, and you come out with an MD and a PhD. And in the research that I did as a graduate student, I was interested in learning about how stress hormones can worsen damage to the brain in models of different neurological diseases like stroke or seizure. But then when I transitioned into residency and I did a psychiatry residency at UCLA, I was interested in doing more clinical and translational work, allowing me to do research with actual patients. And that's what got me into neuroimaging. And I connected with Dr. Anand Kumar there at UCLA and learned about different neuroimaging techniques, basically working with MRI images to understand changes in brain structure, in brain function, and brain chemistry associated with mood disorders like major depression, particularly in the elderly, and major depression in the context of other medical diseases like type 2 diabetes. And then I've continued along the same lines here at UIC with several projects where we apply different neuroimaging techniques to better understand alterations in brain function and structure in mood disorders, and we branched out into anxiety disorders as well. And that's led to a lot of different collaborative projects. What I bring, I think, is twofold. One is my clinical expertise as a psychiatrist that works with patients with mood and anxiety disorders, long history of working with these patients. I also wear a hat where I'm the director of our mood and anxiety disorders program, and I oversee an interdisciplinary team of about 20 clinicians from different backgrounds. And so that clinical expertise I bring to the table for a lot of the research projects that I'm involved in. I've served as a study psychiatrist on other people's studies, so that clinical knowledge comes into play there. The second piece I would say is the neuroimaging component. My first career development award, my K award, was a neuroimaging grant, and all my subsequent awards have involved some component of neuroimaging. So that's another area of expertise that I bring to the table. The types of projects that we're working on now are very complex, and there's no way, as much as I try to have all the knowledge in all the areas necessary to conduct a particular research project, it's just not possible. I think part of it is that science has become very complex, and we cannot be experts in everything. So by bringing in folks who have knowledge and expertise in areas that are relevant to the project, we get that much needed expert opinion on how to conduct the study properly, how to do the analyses properly. One of the things that I learned early on in having grant applications rejected is that when they evaluate the investigator team, one of the things that reviewers want to know is that you have the requisite expertise to conduct the experiments that you are proposing. And so by bringing together a group of folks that, may not know everything in the area, that the specific study is about, but they know enough about maybe a particular methodology that brings a lot of strength to the team. And it's also important too to get a diversity of ideas, because the way our folks in computer science think might be different than the way the folks in psychology think, or the way the folks in gerontology think. And so by having these different backgrounds and diversity of opinions, I think that makes the science stronger too.
Throughout his career, Dr. Ajilore has participated in a variety of interdisciplinary teams. He explained how and why different teams have formed, as well as some of the lessons he has learned about effective collaboration along the way.
How do we know that we need somebody else to work with who has expertise in a particular area? I think that comes in when you sort of reach the limits of your own knowledge, where you know enough to be dangerous, but not enough to know if what you're doing is correct. And it's always important to bring in people who can provide that information for you. Sometimes people are brought in just by mutual interest, and that's how a lot of our collaborations have started, where, for example, with our colleagues in computer science, they've developed all of these machine learning algorithms that they want to test out. But in order to test it out, they need data. We have data from the studies that we've done. And so it's a nice marriage of people who have developed algorithms that need data. We have data that need algorithms. And so the best collaborations are the ones where we both get something out of it. It's not me asking a collaborator to just do something for me, but that they actually feel that they're benefiting from the relationship. I think there are a couple keys. One is to work with people you like. That's really important. You want to be able to get along with the folks that you have as part of your team. The other thing, again, is having collaborators that will get something out of the collaboration. You don't want to treat your collaborators as somebody providing a service for you as the team leader. You want them to be getting something out of the project as well. And if it's mutually beneficial, they will have more skin in the game. Their contribution to the overall project will be better, and they'll be happier for their participation in the project. So I think those two keys are really important in setting up good teams and good collaboration. The Roybal Center for Healthy Research and Aging, they were interested in getting a supplement related to Alzheimer's disease and related disorders. So they were interested in adding neuroimaging components to the pilot studies that they funded. And so they specifically reached out to me to help them develop a neuroimaging core for their center. And we were successfully funded for that supplement. And the success of that supplement was a significant component of the successful renewal of the center grant. So that's probably one of the more recent examples. And it's really branched out with the work that we're doing now using smart connected devices like smartphones to come up with digital biomarkers of these neuropsychiatric diseases. And this is work kind of spearheaded by my colleague, Dr. Alex Liao. And so because of that kind of work, we've brought in folks from computer science who have expertise in machine learning, people who have expertise in programming and coding to develop the app that we're using in these studies. We're bringing in experts who have a background in ecological momentary assessment, where we're able to do surveys and sample how people are doing in naturalistic environments. There's a whole science behind how those types of assessments are done, and so we've brought in folks who have expertise in that area. In addition to the more traditional collaborators that we've worked with, people in neuropsychology who help us with developing neuropsychological batteries to do cognitive assessments. And then we have sort of clinical domain experts, so other psychiatrists. Sometimes we develop these collaborative relationships just out of the pure sort of interest in the science that we're doing together, before thinking about the funding. And, the example I gave before is a perfect example of that, where we have colleagues in computer science that are developing machine learning algorithms that they want to apply to the data that we have. And in those collaborations, we could go from sort of initial meetings to them generating papers on the order of months. But I would say leading to actual successful funding, I think some of those relationships have developed over, let's say, 12 months or 18 months. But it's really, getting to know the collaborator, knowing that you can work together, that you guys can speak the same language, even though you're coming from different disciplines, I think, before you sort of successfully come together for a funding opportunity.
Dr. Ajilore described one of his more recent collaborations that looks at how artificial intelligence may be able to provide on-demand counseling. This could help address the significant care gap for mental health services, an issue that has become even more pressing in light of the COVID-19 pandemic. His hope is that this voice-based approach to therapy is more natural and potentially more effective than some of the existing app-based technologies.
One of our recently funded projects called Speak, which is a study of a problem-solving therapy, artificially intelligent enhanced counselor. Basically, it's a therapy chatbot, similar to Amazon Alexa. Actually, it works off of the Amazon Alexa platform. It's designed to deliver a form of therapy that has been shown to be effective in dealing with patients with depression. This is a project that is led by June Ma, who's in the Department of Medicine, and I'm the co-principal investigator for the study. And it's an interesting study that we're not only developing this new technology designed to deliver therapy, but we're also testing the effectiveness of it by not only looking at clinical outcomes, but we're actually using neuroimaging to see how the therapy changes brain function in relation to those clinical outcomes. So we're bringing together people who have expertise in programming, people who have expertise in ecological momentary assessment and providing mobile intervention. We have people like myself who have expertise on the clinical side, and we have people who have actually delivered this type of therapy face to face, and so they bring in that domain knowledge about the actual therapy itself. And so a project this complex absolutely requires a team approach, because there's so many different parts, so many different moving parts in order to make this happen. And so the first stage of the study is to develop this therapy chatbot app. And in doing that, we're actually involving people who've had the lived experience of these disorders. So we're recruiting people who had a history of depression to actually test it out and help us with the iterative design process, where we use their feedback to improve the quality of the intervention. We're also involving people who have expertise in delivering this type of therapy, so we get their knowledge and expertise, and we can incorporate that feedback in the development of the app. And ultimately, our goal with this type of intervention is to provide a low-cost, high-tech way of lowering barriers to access for mental health care needs, which are rapidly increasing, especially in the wake of the pandemic. We're seeing higher rates of depression. We're seeing higher rates of anxiety, stress-related disorders. So the demand for mental health services is increasing, but the supply is still limited. And we're hoping that we can address this care gap with technology. The same sort of framework could be conceivably used to deliver other types of therapy. And there are some that are already available out there. There are several apps that are designed to deliver cognitive behavioral therapy for a number of different conditions. But we're hoping that this voice-based platform provides a more naturalistic interface for this type of therapy. I think team science is probably the only way to do science properly these days because of how complex research is nowadays and how there's been such an explosion of knowledge within any particular domain that it is truly impossible to know everything you need to do to conduct, sort of science at a large scale these days. Even within neuroimaging, I find myself struggling to keep up with developments in the field because it's rapidly changing. What used to be the standard of practice maybe 2 or 3 years ago is no longer the case now, right? And I can imagine that's the case with all kinds of different fields. So it's really important that you have those experts from different arenas because otherwise it's just impossible to keep up with everything that you need to know to do science these days.
Collaborative Endeavors is produced by me, Lauren Rieger, on behalf of the Center for Clinical and Translational Science, aka the CCTS, at the University of Illinois at Chicago. To learn more about the research discussed in this episode, visit the links in our show notes. A special thank you to Dr. Ajilore for being our pilot interview. We genuinely appreciate the leap of faith. The CCTS is supported by the National Institutes of Health's National Center for Advancing Translational Science through their Clinical and Translational Science Award. The views expressed in this podcast are our own. To learn more about how you can get involved in health research, visit ccts.uic.edu or follow us on Twitter at UIC_CCTS.